Hi. Your department has said it's difficult to pin down how much of the federally funded safe supply of drugs is being diverted into the community, but is listening to stakeholders like the police. What were those stakeholders actually telling you about the diversion of safe supply?
Thank you for the question. When we talk about prescribed alternatives and diversion of prescription medicines, we're not talking about the same thing to begin with. Diversion is illegal. We have said that time and again. And when we talk about diversion being illegal, it is of any prescribed medication. That could be ADHD medication, that could be pain medication that someone has acquired post-op from a surgery in a hospital and goes home with. And diversion of any medication that is not for its dedicated use is illegal in this country. When it comes to the prescribed alternative treatment models that have been put in place, of which 4,500 Canadians are part of federally funded, federally supported programs for prescribed alternatives. We've put in very robust mitigation measures to ensure the safety and use of those treatment services. But again, health is the purview of provincial jurisdictions. We have worked with them very carefully on guidelines of how to administer and prescribe rapid access to addictions medicine. And it's up to the provinces to ensure that their physicians are well trained and well supported in providing supports for their patients and clients who are seeking help with addiction.
And I understand that you're not the public safety minister, but the ministers of Indigenous Services and Crown Indigenous Relations always speak about how there needs to be a whole of government approach to those issues. One of the biggest things that chiefs talk about is the lack of police in their communities to stop drugs from coming in. Do you see that as a problem, and are you working with public safety to get First Nations policing legislation off the ground to tackle issues like the drug crisis?
There is no question that when we look at the four key principles of how we're going to address this overdose crisis and the illegal toxic drug supply, that enforcement is a key piece of the puzzle. But we also know that the war on drugs failed. We also know that we cannot
But that's what community members want. If it's self-determined that they want police there to be, like, having checkpoints there, that's the self-determination of communities. I don't know if they would consider that the war on drugs there.
If you allow me to actually answer the question, what I was going to say is that an enforcement piece is an important piece of the puzzle, and we recognize that and have been working with our public safety counterparts to ensure that those discussions are ongoing to provide those supports, but they are only one piece of the puzzle in helping communities heal and push back against the overdose crisis.
All right, thank you. We're going to move over to the questions that we have on Zoom, starting with Mackenzie Gray from Global News. Mackenzie, if you can unmute.
Hi, Minister Sachs. I'd just like to go back to Stephanie's questions before. I didn't hear a clear answer, so I'd like to give you another opportunity in this. Does your government support provinces using involuntary treatment for folks who have drug addiction problems?
In terms of administering their health care, as we are always committed to do, but as I said previously, I haven't seen enough of a move of scaling to need of treatment by provincial and territorial jurisdictions to meet the moment. And before we talk about involuntary or voluntary treatment, I would like to see them utilize and access the robust $200 billion worth of healthcare agreements that have been signed across the country to dedicate resources to this. This is about political will in allocating the resources that they have to providing treatment access to those who need it in a way that is timely and accessible, and by accessible I also mean low barrier access for those who need it most.
Minister Freeland got asked about this yesterday. I'd like to read back what she said to us when we spoke to her. And this is a quote: "We have to be sure people get treatment they need, and sometimes a person can be too sick to really recognize what treatment they need." Do you think that that is a situation across Canada where people could be too sick to understand that they need treatment?
I think that these are decisions that individuals make with their healthcare providers and with their families and loved ones in the care that is needed for them. And I think that's where we need to keep it focused from a human-centered lens, from a compassionate lens, and from a healthcare lens.
All right.
Head on in some recent announcements. We've been going through his latest speech and the Q&A, and let me tell you, there's a lot to unpack.
It's interesting, though, because it's not just about like building a ton more massive condos. It's much more thought out than that. The prime minister keeps using the phrase multi-pronged approach.
Yeah, and another phrase that kept coming up was gentle density. So it's about creating more places for people to live, but doing it within the neighborhoods that already exist. Like, think basement suites, those little backyard cottages, maybe even a laneway house. But how is the average person supposed to make that happen right? Well, get this. New mortgage rules are coming out to make it easier.
And these aren't like the old school mortgage rules either. We're talking about refinancing your mortgage and getting a 30-year amortization for up to $2 million, specifically for building one of these secondary suites. That's a pretty big deal. For anyone who's not a mortgage expert, a 30-year amortization just means lower monthly payments. It makes it way more doable for people to afford these renovations. It's almost like he's saying, hey, if you want to be a part of the solution, here's some breathing room in your budget.
So instead of just depending on the big developers, he's giving everyday Canadians the power to maybe become landlords, even if it's just for their own family.
Exactly. It's a really interesting approach. Imagine having your parents close by in a cozy little backyard suite, or giving your adult kids a head start with a place of their own. It's all about making it possible for more Canadians to own a home and maybe even live with multiple generations under one roof.
Okay, but here's the thing. Even with more affordable housing options, you still need a decent income to afford any of it, right? And that's something the Prime Minister seems pretty concerned about too. He even wrote a whole book about it, Plutocrats, The Rise of the Global Super Elite and the Fall of Everyone Else. Kind of a mouthful, huh?
Yeah, it does make you wonder if that gap between the super rich and everyone else is just getting bigger and bigger. The Prime Minister definitely seems to think so. He's talking about how it's not just an economic issue either. It's social, it's political, it's about what it means to live in Canada.
It's about making sure everyone has a shot at a good life. So how is he planning to tackle this whole income inequality thing?
Well, one big piece of the puzzle is early learning and childcare. He actually used Ontario as an example. Apparently, childcare costs there are already down by something like 50%. Families are saving an average of like $8,000 per kid every year. And the goal is to cut those costs even further. They're aiming for a national $10 a day system.
Seriously? I mean, as someone who's seen those childcare bills firsthand, $10 a day would be life-changing. Forget a sigh of relief. That's like a full-on dance party for a lot of parents.
Totally. And it's not just about saving money either. It's about giving parents more choices. Affordable childcare would make it easier for parents, especially moms, to go back to work if they want to. It's about giving people more opportunities and flexibility.
And speaking of making things a little easier on the wallet, he also talked about that new dental care program. Sounds like a lot of people are already signing up for that. Something like 2 million Canadians and counting, I think he said.
Which makes sense, right? Dental care is so important, but it can get really expensive. This program is supposed to help with that so people don't have to choose between paying their bills and taking care of their teeth.
It's about having peace of mind, knowing you can get the care you need without going broke.
Exactly. And then there's the push for more green jobs.
Yeah.
But not just any green jobs. The Prime Minister was really clear about needing strong labor requirements.
So making sure these jobs actually pay a living wage with decent benefits, right?
Right.
Not just creating a whole new category of low-paying jobs in a brand new industry.
Exactly. It's about giving people a real path to the middle class. Making sure that the switch to a greener economy actually helps everyone. So yeah, we've covered a lot of ground here, from building more homes to making those homes more affordable and dealing with this big issue of income inequality. But what about the economic engine that's going to make all of this happen? The Prime Minister had this really interesting meeting with a tech CEO that kind of gets at that.
So they were talking about critical minerals, those things that are like the basic building blocks for everything from electric car batteries to those fancy solar panels everyone wants these days.
Yeah, it's a pretty crucial point, actually, because as the whole world tries to switch over to this greener economy, the demand for critical minerals is going way up. And here's the thing, Canada's got a lot of them, just sitting there.
Okay, so we've got the good stuff. We're all set then, right?
Not quite. Here's the catch. China's kind of got a monopoly on the whole critical minerals thing right now. They control a huge part of the supply chain. And that's a big challenge for Canada and all of our allies.
So it's like a tug of war over these resources.
Kind of. There's this big push for everyone to diversify, basically, to find other places to get these critical minerals. So we're not all relying on China so much. The Prime Minister even mentioned something about targeted Chinese action, like they're trying to stop anyone else from competing with them.